Dorothy Orem, the nursing theorist, will be presented by Group 4, which includes Carrie Silva, Nixon St. Bernard, Jessica Stanley, Juliana Tafiro, and Andrea Webb. Dorothy Orem's theory is the self-care deficit theory of nursing, and it belongs to the family of health services that are organized to provide direct care to persons who have legitimate needs for different forms of direct care. Dorothy Orem believed that people should be self-reliant and responsible for their own care. She believed that people are indistinct individuals, nursing is a form of action, and a person's knowledge of potential health problems is necessary for promoting self-care behaviors. Dorothy Orem was born in Baltimore on July 15, 1914, and she died on June 22, 2007. She achieved a master's degree in nursing education, and she was first published in 1959. As far as global observations, the ability to conceptualize, goal-oriented, and mentoring expertise are the top 3-tier situations in this theory. Self-care deficit nursing theory was presented in the 1950s and has been refined for more than 20 years. Orem's worldview of nursing led to her conceptual framework, and theories have provided a foundation and inspiration for many to continue her study. Related to the meta-paradigm in nursing, the human is a reasonable organism with rational powers, involves human and environment being a combination of a system regulated to self-care. The goal of nursing is to make the patient and family capable of meeting their self-care needs. Self-care is the responsibility of the whole community and attributes to the nursing care for the patients. Three self-care requisites according to Orem are universal self-care requisites, developmental self-care requisites, and health deviant self-care requisites that will be discussed later on in the slideshow. Orem's theory emphasizes the importance of self-care in maintaining an individual's overall health. The conceptual framework of Orem's self-care theory includes self-care, self-care demands, nursing agency and its deficits, and self-care agency. Three fundamental concepts include self-care, which is the activities the individuals are able to perform on their own to maintain their health. Self-care deficit includes things where they don't really meet their goals and nurses need to intervene. The nursing system as a whole extends to help manage the health and well-being of individuals when they face self-care deficits. Concepts of Orem's self-care theory include self-care, self-care requisites, self-care agency, and therapeutic self-care demand, which we mentioned in previous slides. As you can see, self-care is the deliberate action to supply necessary materials for continued growth and survival of human dignity. The three parts of self-care include universal, developmental, and health deviation. An individual's ability to engage in self-care related to self-care agency and the nurse assisting in meeting an individual's self-care needs is reliant upon the therapeutic self-care demand. In the nursing meta-paradigm, the nurse, health, human, and environment are important aspects, and how the nurse applies their skills when caring for the patient is included in nursing. That includes nursing actions, and as far as the person is the recipient of the care. Health is defined by the person, and the environment includes internal and external factors that are related to the meta-paradigm. Nursing, health, humans, and environment are all major concepts of Orem's theory related to the meta-paradigm. One middle-range theory that was based on the grand theory of Orem's self-care deficit theory is the theory of self-care of chronic illness. You can have a grand theory, a middle-range theory, or practice theory. And in this middle range theory, the key concepts of the mid-range theory include self-care maintenance, self-care monitoring, and self-care management. This middle range theory is useful in determining assessment needs in self-care. For example, how well is the patient able to recognize their own symptoms of illness? More tailored interventions can be implemented based on patient need. And this middle range theory is important in scientific research because it can help develop measures for self-care for chronic illness based on this mid-range theory. In this slideshow, you will see concepts and definitions which are all related to Orem's theory. The concepts include self-care, self-care requisite, universal self-care requisite, developmental self-care requisite, health deviation, therapeutic self-care, deliberate action, nursing system, and the product of nursing. You can see here how all of these combine and create a useful theory in nursing. Orem's self-care theory has been used in many colleges and hospitals and helps guide nursing intervention and empower individuals to take an active role in their health. Orem's model can help educate students in the importance of self-care and how they help their patients in this area. Numerous schools have based their curriculum on Orem's self-care theory, as it is one of the most well-known and popular theories available in nursing today. In this patient case scenario, Michael is a 54-year-old male diagnosed with type 2 diabetes. He has recently been diagnosed and he ensembles a self-care deficit because he works all the time, he forgets to take his medication, and he doesn't really know what a healthy diet is. To apply Orem's theory, the nurse will begin to assess the self-care abilities and acknowledge any deficits that may be present. The nurse will evaluate the understanding of what Michael believes to be important about medication adherence, eating well, exercising, and monitoring blood glucose levels. Any learning deficits will then be reinforced. The nurse will then create a care plan which will be individualized to create Michael's specific self-care need background. This plan will help give Michael useful tips and resources on how to manage diabetes. Education will be implemented, and then monitoring will continue to follow up and make sure Michael's progressing in a positive direction. An application of Orem's theory-based caring programs among critically ill adults was a systematic review and dose-response meta-analysis that was performed. The review study was published in 2023, and it evaluated the efficacy of caring programs developed according to Orem's self-care nursing theory. The findings of the study suggest that Orem theory-based programs influenced positive outcomes among adults with chronic disease. Self-care and self-efficacy interventions significantly improved quality of life and reduced depression and anxiety. Orem's theory can be considered complex as well as simple. Orem defining her self-care as activities performed independently by an individual to promote and maintain well-being. The self-care deficit is considered the inability to perform functions related to health and well-being. Examples include bathing and dressing. Deficits then can arise from various impairments ranging from surgery, recovering from surgery, mental illness, or age-related mobility issues. Nurses can determine if a patient is facing a self-care deficit through 3 steps defined by Orem. You can see those here on this slide.
Mommy.